Hello, I'm Dr. Randy Beers, and today I'd like to discuss with you minimally invasive treatments for BPH. What's BPH? Benign prostate hyperplasia. It's the enlargement of the prostate. The prostate is a gland that only men have. It has to do with sexual function and sexual reproduction. The prostate's located just below the bladder, and it surrounds the urethra, the tube through which you empty your bladder. As a man ages, the cells within the prostate begin to increase in number. The exact cause for this is not fully understood. As a prostate grows, it compresses the urethra, making it difficult or painful to urinate. It's important to note that enlarged prostates do not necessarily indicate cancer, and they're not necessarily life-threatening, but enlarged prostate does affect the day-to-day life in inconvenient and unpleasant ways. Common symptoms of BPH include increased frequency of urination, including the need to get up at night to pass your urine, a feeling of urgency to urinate, and starting and stopping of the urinary stream as it flows. These symptoms disrupt and limit normal daily routines such as work, family activities, and recreational activities. If left untreated, BPH can lead to more serious health problems, such as urinary retention, bladder stones, bladder infection, or the need for surgery. If you are experiencing any of these symptoms, you should be diagnosed and treated by a urologist. We use a variety of tests to diagnose and determine the severity of BPH. One evaluation is called the International Prostate Symptom Score, or IPSS. You answer 7 questions by rating them from 0 to 5, which indicates the severity of the problems. The scores are then added up and categorized as mild, moderate, or severe. We may also perform a urine flow rate test and a digital rectal exam to determine the general size and condition of the prostate. In order to rule out prostate cancer, we will also do a PSA blood test. There are a number of treatments available for enlarged prostate. You will need to discuss the advantages and disadvantages of each treatment with your urologist. Depending on your medical history and the severity of your symptoms, you and your physician will decide together which treatment is best for you. For treatments for patients with mild BPH, we may recommend watchful waiting before treatment. You will be asked to come in on a yearly basis for a regular exam and to monitor the symptoms to see if they are stable or getting worse. If they seem to be getting worse or interfering with your normal routine, we may recommend another form of treatment. Several medications are available to treat prostate enlargement. Some of these medications are known as alpha blockers. They relax the muscle of the prostate and bladder neck to help relieve the symptoms of enlarged prostate. Other medications actually cause shrinkage of prostate tissue. In many practices, medication is offered to the patient first and can be an effective choice for many men. It is simple. It does not require surgery or a medical procedure. However, the medications must be taken for the rest of your life, once or twice a day, and over time the cost can become very large. Medication is not effective for all patients, and the side effects can include fatigue, headache, dizziness, impotence, loss of sexual drive and interest, chronic sinus congestion, and low blood pressure. Today, there are several office-based treatments that are available that use targeted heat to shrink the prostate. Some of these treatments are more effective than others, but they all have the advantage of not requiring a general anesthesia or stay in the hospital. Recovery time is fast and side effects are minimal. One of the most common forms of treatment is the transurethral resection of the prostate, or TURP. This involves insertion of a metal instrument through the urethra to cut away the enlarged prostate tissue. Surgery is typically very successful, but it does require a general or spinal anesthetic. There are complications that can occur, including the possibility of postoperative pain, discomfort and bleeding, urinary incontinence, retrograde ejaculation, and impotence. Since most of you who have BPH are either on medications or will be at some point, I'd like to share with you a simple truth. BPH meds are not for everybody. Recent studies show that 48% of men on BPH drugs do not have clinical significant improvement. 23% of these men experience impotence. Overall, many men are unhappy with BPH meds because of the lack of symptom relief, the side effects, or the continuous cost, and basically just don't like being tied to medication every day. If you are unhappy with BPH medication or simply want to avoid the side effects and the high cost of medical therapy, it may be time for you to think outside of the pill box. Cool thermal therapy, or CTT, is a non-surgical procedure that can be done right in my office. Clinical studies show that it produces significant relief with reduced risks that may be associated with a more invasive surgery or the side effects that occur with drug therapy. This treatment does not require hospitalization, general anesthesia, or a long recovery time. Studies show this therapy has a long-lasting result. Prostate RF therapy is a treatment that can be done right in my office. Clinical studies show that it produces significant relief with reduced risk that might be associated with a more invasive procedure, surgery, or the side effects that can occur with drug therapy. This treatment requires no hospitalization, no general anesthesia, and has minimal recovery time. Studies show this has a long-term benefit. Both options are a single, non-surgical procedure that can be done right in my office or in an outpatient department of the surgery department at the hospital. Clinical studies show they both produce significant relief with reduced risks that may be associated with more invasive surgery or the side effects that drug therapy can cause. Neither treatment requires hospitalization, general anesthesia, or a long recovery time. Studies show that both therapies have lasting results. What type of prostate gland do you have? Your physician will decide which option will be best for you. For larger prostate glands, 50 grams or over, cool thermal therapy will work very well. And for the smaller, irregular glands or with median lobe, Prostiva is very effective. Both therapies are non-surgical procedures that can be done right in my office or in an outpatient department of the hospital. Most men resume their normal activities within a few days following treatment. Although it varies, most of my patients start to see significant improvement in their symptoms within the first month or two following treatment. That's the MIT advantage, minimally invasive therapy. Therapies are performed in the comfort of my office without invasive surgery or added risk of general anesthesia. Imagine a happier you, free from BPH symptoms, thanks to a safe, proven, non-surgical treatment that provides lasting relief without side effects or the high cost of medication. Why not think outside the pill box? I thought I'd answer a few questions that many men like you have asked me. The first question many patients ask is this procedure painful? There is some minimal discomfort with the procedure. It's done under a local anesthesia, but after the first few days, most people are very comfortable. We do give pain medication for the first 24 to 48 hours. It usually helps. There may be a sensation of burning that occurs in the first day or two, but this usually goes away very quickly. Another question men frequently ask following the procedure is, how long are the results going to last? Published studies would indicate there's good results that last for at least 5 years. In my experience, and I've been doing the procedure for over 10 years, we have a very satisfied patient population, and only a few people come back during this time for either a second procedure or additional treatment. Another question many men have is, how expensive will this treatment be? And for those of you already on medication, you already know that the cost of daily medication can mount considerably. The one-time charge for a minimally invasive procedure is usually covered by insurance and eliminates the regular charge that you'll have over the next few years by taking medication on a regular basis. Another question many patients have is the minimally invasive treatment covered by insurance? The answer is usually yes. Most insurance companies and Medicare will cover the procedure, but for any questions, please contact the office.